Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 327 of the Ask Dr. Angela podcast. It has been a minute, like a minute. Not even a minute. It's been forever since I've released a podcast. I mean, a lot has been going on since we last met. Let's talk about it. There's the pandemic, which we are still certainly going through. There is the insurrection on Capitol Hill. And now there's the flipping snowstorm that's hit the Northeast. This is actually my second snow day. I'm not in the office today because of so much snow. My neighbors were so generous and they plowed me out yesterday morning, but I had to go back 2 additional times to shovel my drive because there was so much snow. And given that I am essential personnel, I can't risk not being able to get out of my driveway. So I've missed you all, but I'm so excited to be back. So let's just jump right into it. Today's topic is cervical cancer. And even though it's now February, January was Cervical Cancer Awareness Month. So I had to do something on cervical cancer. I mean, as an OBGYN and being the queen of one of the most effective cancer screening tests, i.e. the pap smear, I just had to do something. We do know that cervical cancer is strongly associated with HPV, which is also known as human papilloma virus. So I'm going to get us through this. We're going to talk about HPV. We're going to talk about sequela that's associated with it. We're going to talk about one of the big C's, cervical cancer, signs, symptoms, and the next steps once you're given that diagnosis. So let's jump right in. Pap smears. Pap smears are the screening test for cervical cancer, and it starts at the age of 21. The actual test itself has never been like one of the top 3 favorite things that women like to have done. It's like a matter of who would you rather, the dentist or the gynecologist. I mean, you take your pick. A pap smear is performed by visualizing the cervix at the top of the vagina. Contrary to popular belief, the vagina is not some never-ending tunnel. There is a cervix at the top of the vagina. The cervix represents the lower aspect of the uterus, and we obtain a pap smear by visualizing the cervix with a speculum, and no worries, they're not one size fit all. We will find a speculum that suits your vagina just fine. But anyway, we take a sidle brush, a spatula, or even a cervical broom to obtain a sampling of cells from the inside and surface of the cervix. These cells are then sent to the lab for evaluation. In persons that are 21 to 29, HPV testing is not typically performed. In this age group, HPV testing is done reflexively, specifically if there's an abnormality that's found on the pap smear. In women that are aged 30 to 65, HPV co-testing or testing for HPV at the time of the pap smear is performed. How often you get pap smears is a conversation that you will want to have with your OBGYN. In women that are under 30, as long as there are no obvious abnormalities or previous abnormalities, you can typically get away with doing a pap smear every 3 years. In women that are between the ages of 30 and 65, either a pap with no HPV testing can be done every 3 years, or a pap smear with HPV co-testing can be done every 5 years. Having said that, regardless of how often you decide to get your pap smear, you should still see your OBGYN annually. Because remember, at the time of your annual exam, the pap smear is only a small part of your annual exam. The remainder of your exam will allow a review of your medical history, assessment for risk factors for other medical issues, ascertainment of current health and fitness. You get a breast exam done, and your annual exam is also an opportunity to discuss any transitional phases in your life that may be up and coming. Things like family planning, perimenopause, menopause come to mind. Pap smears do not need to be done annually because the one thing that we've learned about cervical cancer is that it does not develop overnight. It's a process. Hence, it's okay to not overscreen. So a little bit about HPV. We cannot have a talk about cervical cancer and pap smears without mentioning HPV. We know that HPV is a sexually transmitted infection, and it's very common. About 80% of the sexually active population has been infected with HPV at some point in their lifetime. To make my life as an OBGYN easier, we typically divide HPV into two groups, low risk and high risk types. Low risk HPV types are associated with things like genital warts. High risk HPV types, especially types 16, 18, and 45, are associated with cervical cancer. In most, HPV is a virus that will be cleared on its own. Specifically, in healthy individuals, most HPV infections are asymptomatic and will resolve without any issue. HPV can be associated with cancers of the vulva, the vagina, the penis, the anus, the mouth, and throat. Therefore, safe sex is a must and is highly encouraged. Barrier contraception, as well as having an open conversation with new partners about their sexual activity, practices, etc., will help decrease acquisition and passage of not only HPV, but other STIs or sexually transmitted infections. As pertains to pap smears, HPV can be transient, and it can cause transient cervical abnormalities like low-grade lesions. These will typically resolve on their own and require little more than observation. Other high-risk forms of HPV can be associated with more significant lesions like high-grade abnormalities. These have a higher propensity of developing into cervical cancer and hence require more aggressive management. Pap smear abnormalities are typically confirmed through an in-office procedure called a colposcopy. A colposcopy, or a colpo, is an opportunity for your GYN to look at your cervix under high magnification. The setup for a colposcopy is just like a pap smear, and that a speculum is inserted into the vagina to allow for adequate visualization of the cervix. The cervix is then painted with a vinegar-like solution to help highlight any areas of concern. Based on the appearance of the cervix, biopsies may or may not be performed. The purpose of the colposcopy is to confirm pap smear findings and to ensure there isn't a more significant abnormality present. In addition to safe sex practices, the HPV vaccine is an effective way to protect against types of HPV that have the highest association with cervical cancer. The HPV vaccine is most effective when it's given to girls and boys ages 11 to 12. It's typically given through the age of 26, but it can be given after age 26 in those individuals that have never been vaccinated or that are at an increased risk for HPV infection. So let's talk about pap smears, HPV, and cervical cancer. We've mentioned pap smears. We've addressed that certain types of HPV have a strong association with cervical cancer, but let's talk about cervical cancer itself. Cervical cancer occurs when cells that typically make up the cervix become abnormal. This abnormality typically manifests as cells dividing much more rapidly than usual, invading deeper tissue layers, and eventually either spreading to other organs or forming a mass or a tumor. It typically takes several years for cervical cancer to develop, which is why screening tests like pap smears that can detect early cervical changes are important. Remember, cervical cancer does not develop overnight. But having said that, this is why it's so important to make sure that you continue with your regular screening and annual visits. Risk factors for cervical cancer include things like early age of first intercourse, like earlier than 18, having multiple sexual partners, having sexual partners that have a high-risk profile, high risk being defined by types of sexual activity and or the number of sexual partners. Other risk factors for cervical cancer include smoking, a personal history of vulvar cancer, cervical or vaginal dysplasia, family history of cervical cancer, and a history of sexually transmitted infections. Remember, where there is one STI, you will find others. And also remember, HPV is a sexually transmitted infection. Initial signs of cervical cancer will include things like abnormal bleeding, spotting, or a watery discharge from the vagina. Bleeding or spotting may occur after sex. Pelvic pain, issues with urination, swelling of the lower extremities can all be signs of advanced disease. Once cervical cancer is diagnosed, it is confirmed via colposcopy, as previously discussed. The colpo will provide a biopsy for confirmatory purposes. Once confirmed, cervical cancer will need to be staged to determine the extent of invasion and spread to neighboring organs. Staging can be accomplished through various procedures such as a thorough pelvic exam, a colonoscopy, and cystoscopy to evaluate the bladder and bowel, respectively. Imaging techniques may also be utilized to assess lymph node involvement. As a generalist, once I diagnose cervical cancer, I refer to a specialist for further management and treatment. That specialist is a GYN oncologist. Treatment options for cervical cancer will range from hysterectomy to radiation therapy to chemotherapy, depending on the stage of your cervical cancer. Remember, cervical cancer, one of the big C's that can affect women, while it's scary, it is preventable. Please make yourself a priority and stay up to date with your screening. Boom, cervical cancer. I have to say, it is so good to be back. I have missed you all so much. There's just a lot going on in the world. I'm going to encourage you to please check out my new and improved website. It's still AskDrAngela.com. That's www.askdrangela.com. AskDrAngela.com. The layout is amazing. I've got a new merchandise store, and you can still sign up for, any of my social media platforms. That's Instagram, Twitter, Facebook. And just make sure that you sign up for my weekly blog post as well as my YouTube channel and my podcast. I'm so amazed at the reach of not only my blog post, but my podcast, my YouTube channel, etc. In closing, I am going to leave you with this from my still favorite book by Sandy Gingras, She Went Out on a Limb, a book of inspiration for women. And today's quote says, "Hope will carry you through even the deepest water." I think that's pretty significant given the state of affairs today. Until next time, choose happiness. I cannot wait to reconnect with you on episode 328 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.